Have you ever wondered why you feel compelled to wash your hands repeatedly, check the door again and again, or keep everything perfectly aligned? These aren't just your habits. They may be part of a deeper psychological pattern, silently breaking you from within. Those strange, intrusive thoughts that enter your mind uninvited, that constant need for reassurance. Could these be signs of an underlying fear you've never dared to talk about? What are these forces that keep controlling you again and again? Are they just your habits, or is there a hidden mechanism in your mind that's silently pulling the strings? Hello, everyone. I am Dr. Syed M Quadri, a U.S. board-certified psychiatrist. For the past 20 years, I have been treating patients dealing with anxiety, stress management, and mental health challenges. Today, we're going to uncover 22 mysterious symptoms and their scientifically proven treatments, all of which are part of OCD and which can not only transform the way you think, but also the way you live. Let's get started. 1. Contamination obsession, a persistent, irrational fear of germs, dirt, or getting sick. Individuals may avoid touching surfaces, public places, or even loved ones. This often leads to compulsive hand-washing, cleaning, or sterilizing behaviors, which can severely impact daily life. Exposure and response prevention, a gold standard treatment under cognitive behavioral therapy, is highly effective. The therapy gradually exposes the person to feared contaminants while preventing the compulsive cleaning response, helping the brain learn that the anxiety will reduce on its own. 2. Checking compulsion. Compulsive behaviors like checking door locks, stoves, or switches repeatedly. This stems from an intrusive fear that harm may occur if these items aren't verified, despite no real threat. It leads to delays and disrupted routines. CBT with ERP helps individuals resist checking behaviors. By repeatedly facing the anxiety without checking, the brain learns that nothing bad happens. This weakens the compulsion over time. 3. Symmetry and orderliness. What's the problem? Some individuals feel that everything must be perfectly symmetrical and just right, whether it's straightening books, aligning chairs, or even walking in a specific pattern. If something appears even slightly out of place, it creates intense mental discomfort, prompting them to spend hours fixing it. Why does it happen? The brain interprets misalignment as wrong or incomplete, triggering anxiety. To relieve this distress, the person feels compelled to correct or adjust things repeatedly. What's the treatment? CBT and ERP therapies help challenge this compulsion. Individuals are gradually taught to leave things imperfect on purpose, allowing the brain to learn that anxiety can fade without having to fix everything. 4. Hoarding. Persistent difficulty discarding possessions, regardless of their value. Individuals often form emotional attachments to seemingly trivial items, leading to overwhelming clutter that impacts safety and functionality at home. A specialized form of CBT for hoarding focuses on improving decision-making skills, organization, and emotional regulation. Therapy often includes motivational interviewing and skills training to help individuals let go of excessive possessions. 5. Intrusive thoughts. Unwanted and disturbing thoughts, often violent, sexual, or blasphemous in nature. These thoughts are ego-dystonic, meaning they go against the individual's values, causing intense guilt and fear. The person may try to suppress or neutralize them through mental rituals. ERP is the most effective treatment. It involves gradually facing these intrusive thoughts without trying to neutralize or avoid them. Over time, this reduces their emotional intensity and frequency. 6. Counting compulsions. A strong urge to count steps, objects, or mental repetitions in specific patterns. People feel that if they don't count correctly, something bad will happen. This interrupts daily activities. CBT helps the individual recognize the irrational link between counting and harm. Through ERP, the person is encouraged to resist counting behaviors, thereby retraining the brain to tolerate uncertainty. 7. Religious obsessions. Excessive fear of committing sins, offending God, or not performing religious rituals perfectly. Individuals may overpray, confess repeatedly, or avoid sacred places out of fear of spiritual failure. CBT with ERP helps reduce compulsive religious rituals. The therapy involves gradually facing feared religious thoughts or scenarios, while refraining from ritualistic behaviors, allowing the anxiety to fade naturally. 8. Sexual obsessions. Intrusive sexual thoughts that are unwanted, disturbing, and unrelated to the individual's true desires or values. These may involve inappropriate subjects, causing deep shame and anxiety. ERP therapy allows individuals to confront these thoughts without avoidance or mental rituals. With time, the emotional response diminishes, and the person learns the thoughts are not harmful or representative of their identity. 9. Fear of causing harm. Obsessive worry that one might unintentionally harm others or oneself. This may lead to avoidance of knives, driving, or being near loved ones, even without any history of violence. CBT strategies focus on challenging the irrational belief that having a thought means it's dangerous or intentional. ERP gradually exposes the person to feared situations, helping them resist avoidance and the urge to seek reassurance. 10. Need for reassurance. Constantly asking others if something is okay or safe to relieve anxiety. This may include repeating the same question or scenario multiple times, driven by doubt and fear of consequences. CBT helps build tolerance for uncertainty. The person learns to rely on their own judgment rather than external validation, gradually reducing the anxiety that drives the need for reassurance. 11. Avoidance behaviors. Avoiding certain people, places, or objects to escape obsessive thoughts or triggers. For example, avoiding public restrooms due to fear of contamination or not using sharp objects due to fear of harm. ERP is highly effective here. It encourages gradual and controlled exposure to the feared situations while refraining from avoidance or safety behaviors, helping the brain rewire its threat response. 12. Mental compulsions. Performing rituals silently in the mind, such as counting, repeating words, or mentally reviewing actions to neutralize anxiety. These compulsions are invisible but mentally exhausting. CBT with ERP is used to bring awareness to these mental rituals. Therapy helps individuals resist engaging in them and builds tolerance for the discomfort these thoughts cause, eventually reducing their power. 13. Superstitious behaviors. Engaging in actions like tapping, touching, or repeating certain routines to prevent imagined negative outcomes. These behaviors are driven by irrational beliefs in luck or fate. CBT helps individuals challenge superstitious thinking and decouple it from the sense of safety. Through behavioral experiments and ERP, the patient learns that avoiding these rituals doesn't lead to harm. 14. Perfectionism. Persistent fear of making mistakes or not doing something just right. This may lead to repeated rewriting, rechecking, or mental paralysis in decision-making. CBT helps the individual reframe rigid all-or-nothing thinking. Therapy introduces the concept of good enough and promotes flexibility and self-compassion instead of compulsive correction. 15. Fear of illness. Obsessive worry about getting sick or already being sick, even without real symptoms, leads to frequent doctor visits, checking bodily sensations, or avoiding public spaces. ERP therapy helps individuals confront their health-related fears without engaging in checking or reassurance-seeking behaviors. Over time, this decreases anxiety and restores a realistic sense of health risk. 16. Excessive cleaning. Engaging in repeated and time-consuming cleaning rituals, often to avoid contamination or illness. ERP is the gold standard therapy. It involves confronting feared contaminants and resisting the compulsion to clean. Over time, anxiety reduces and the brain relearns that cleaning isn't necessary. 17. Fear of losing control. Constant worry about losing control and harming oneself or others, even without any desire to do so. CBT techniques address irrational fear by challenging catastrophic thoughts and teaching self-trust. Therapy reinforces the understanding that thoughts don't equal actions. 18. Obsessive rumination. Getting mentally stuck on philosophical, moral, or existential questions without resolution. CBT helps individuals identify when thinking turns unproductive and teaches how to redirect to constructive problem-solving or mindfulness. 19th. Excessive doubt. People with this symptom constantly question their decisions or actions, fearing they've made a mistake or missed something crucial. This leads to repetitive checking or mental review. Cognitive behavioral therapy, CBT, helps break this cycle by challenging irrational thoughts and teaching individuals to accept uncertainty. ERP may involve making a decision and resisting the urge to revisit it. 20. Fear of saying the wrong thing. This involves persistent anxiety about offending others, making inappropriate comments, or being misunderstood. People may rehearse conversations or avoid speaking entirely. CBT helps by identifying distorted thought patterns and replacing them with rational, compassionate beliefs. Individuals learn to tolerate discomfort and realize that occasional mistakes are normal and acceptable. 21. Compulsive confessing. This includes an overwhelming need to confess perceived wrongdoings, even if they are trivial or imagined, just to gain relief or reassurance. CBT and ERP teach individuals to resist the urge to confess and instead sit with the anxiety. Over time, the discomfort fades, reducing the reliance on confessions. This approach helps retrain the brain not to associate confession with emotional safety. 22. Avoidance of sharp objects. A person may avoid knives, scissors, or even sharp pencils due to irrational fears of hurting themselves or others, despite no intention of doing so. ERP involves safely and gradually introducing these objects in a controlled setting. Over time, the brain learns that being near sharp objects doesn't lead to harm, breaking the link between fear and avoidance. Now that you've learned about the 22 mysterious symptoms of OCD and their scientifically proven treatments, one thing is clear: these are not just habits. They are part of a neurological pattern in the brain that needs to be understood and managed. OCD is a serious mental health condition, but with the right therapies like CBT and ERP and with proper awareness, it can be effectively managed. If you or someone you know is struggling with these symptoms, seeking help is not a sign of weakness, it's a sign of wisdom and strength. If this video was eye-opening for you, please give it a like. Let us know in the comments which symptom you related to the most. And don't forget to share this video with a friend or family member who might need it. And yes, next week we'll talk about the difference between OCD and anxiety, a topic many people get confused about. Don't forget to subscribe to Dr. SM Quadri because your mental health is our top priority.